exactly is it supposed to be with your description?
It's quite broad.
Tuseme uko hospitali, wewe unakaa ofisi gani?
It's quite broad. Because health systems, a system is a conglomerate or a set of things which come together to make it work.
Yeah.
So with health system, they're like various parts. Various parts like this. The health workforce, we have medicines, vaccines, and technologies. We have the infrastructure. We have information systems, right? So and governance as well.
Yeah.
So we have various parts of the health system. So me being a health system professional means that I can address multiple issues.
Sure.
So I feel that it's important to niche into something or to address a problem.
Okay.
And at this point in time, the specific problem that I'd like to address is in the health workforce. So
Okay.
all those building blocks that make up the health systems are selected, that let me deal with the health
Or
work,
human resource.
the human resource. So at this point in time, I talk on my LinkedIn, I talk a lot about transformational leadership in healthcare, because I believe that one way of empowering the health workforce is in equipping them as leaders. In med school, we're taught to treat, and not many people invest themselves to teach us leadership.
Yeah.
How do I grow as an empathetic doctor? How do I communicate? Because leadership is not just about holding a microphone in front of an audience. How is my personal leadership? So I'm speaking into that space, as well as a patient advocacy space. So patient advocacy involves addressing matters of service delivery. So are the patients receiving the care that they need to receive? How are we approaching them as health? Quality. How are we addressing quality to the patients? Are our systems responsive to the patients? So this means that I can work in various places. On top of that, because I have knowledge of health policy, I can do policy analysis. So I can be involved in teams that deal with policy conceptualization, implementation.
Like the people came up with SHA.
Right. There was a team of people, that look at the policy.
I don't like since they had a health.
A policy specialist.
They did. If they did, I get that.
Well, one of the things we did actually in this program, the master's program, is just evaluating or appraising health policies. Just the evidence-based policy making was emphasized in this appraisal. So when you're going to make a policy, what is the evidence that backs that decision? I think that's
So they track the fact and know.
yes. So that's something that's very much into that's very emphasized in health policy. That we need to have evidence-based policy making, not sentiment-based policies. That I wake up in the morning, I'm like, wow, this system is not working. Let me change it for my relatives also.
Na huyu mama mbo asilipe kitu akienda hospitali.
Daktari?
Na mtu ya bodaboda atalipa 50 bo.
Well,
Kwa mwaka.
I'm not going to make a comment of that. But what I'm going to say is we need more evidence-based policy making. And that's one of the things we really studied in this master's program. But we have to start from somewhere. And I'm an early career professional. I'm starting out in this field. So at this point in time, those are the things I'm tackling. So as I grow, even into, policy level, those two things are near to my heart. The health workforce
And
patient advocacy.
those are very important things.
Hey.
Yeah, and I think they are at the core of our problem as a country in terms of our health delivery, especially in the public sector. Because we see, we work in most private hospitals, and you even have patients giving feedback about, how they were treated and all that. You'll have, doctors having a limit number of hours they can mark, say they will have, or we need to ensure quality. But then you go to the public sector, and first of all, the infrastructure is not even there. The medication is not there. When it comes to stuff, you like one doctor before the whole fish. Then patients come, they're just treated the way they're treated. Because the doctor is even frustrated. You've been seeing the patient the whole day. wote unawatuma huko kwa pharmacy, wanakuja ambia mimi naambiwa hakuna dawa, unawatuma lab, sina pesa ya kufanya hiyo test, spectre. And as a doctor you're frustrated, and then yeah, then it reflects in how you treat now the patient.
Yeah.
So
That's why I'm telling you, the health system is so broad. You can't deal with one without another part popping up. So that's why you need more health system professionals. For people to reach down on other clinics.
is there such training in Kenya ama lazima mtu afike pale Lodu?
There is. It's just that I think the modules covered are different. So the modules we did under health policy planning and financing were not modules I found in the courses here. So it depends on which one. There are courses I've seen or master's programs I've seen that tackle or that go into public policy and social policy. So I mean, if you have that knowledge, it can apply to health. But then there are some modules that you won't find, or there are some, we call them uniques, some topics that won't be covered that you might find in, as I did in LSE, HTM. So I guess it goes down to what you're looking for. But there are, I think there are amendments that I like. Okay. Yeah.
Amazing. And it can be trickled down, like if you're put in a place and then you start implementing policy, can somebody learn by a prison? Like maybe unafunza wa medsu. This is what's supposed to happen even if they don't go for the classes that you did. Can you give like some shots? The talks they do in webinars, things like that.
I mean, you can't
them to influence the policies maybe of a local hospital. That possible? Ama za unakaa tu kwa ofisi from there, or can you come to the ground and talk to the doctor and tell them this is what we can do?
I mean, it's a specialist role, much like being an ENT surgeon. So an ENT surgeon can come and teach you, but at the end of the day, you're not a surgeon. You'd have to go to school to become one. There's some nuances in health policy development that are not common knowledge to someone who's not in the field. So there's a lot of jargon involved. And that's why, it would be important to go through that pathway for you to be a health policy professional.
Interesting. Do you see yourself at MH?
I do. Nipewe job. Naweza handle. I can handle it. Naweza kabisa. Yes.
There's politics there.
Of course, health is quite political. Health is political. Yes.
We had Dr. Florence the other day. Dr. Florence happened to rise through the ranks very, very early in her career. And she found herself as one of the she was in the office of the CEC of Health of the county. Yeah. And then she worked there for I think 3 months. And she said, I'm resigning. So the politics is too much.
Yes.
People, we say that this is what is needed. But people say, no, the money should go this other way.
Yeah, I think one of the injustices we do or we practice on ourselves is to deny the fact that health is very political. There was one of the frameworks we learned in uni by a man called John Kingdom. There are three streams. So like if you're making a policy, there is the problem part of it. So there has to be a problem in your story, and that's why you have a policy, right? And the second one is the solution stream. Then what is the solution to that problem? And in the problem stream, the public, in most cases, the public has to agree. There has to be goodwill from the people that this is a problem and we have to solve it. And then you have the solution stream. You have something, a framework that you want to develop to aid in fixing the problem. But finally, you have the political stream. So you need political goodwill to create room for these policies to go through. And that's why you see policies sometimes that are not sensible, but they go through because there's the political arm of the day that is quite influential. And the thing about policy and politics is that politics what matters a lot is power. Politics is about power. It's not about numbers. You can be 100 people with little power, and you can be one person with a lot of power. So once you have a group of politicians who have agreed that this thing will go through, remember they have stakeholders.
Yeah.
Maybe they have
interest.
they have political interest, one, and then they have stakeholders, external stakeholders who are giving money.
Exactly.
We as the people, we have a voice, but financially, can we give 100 billion towards, you see, for example? So that's where we get put out. But then that's why we have bodies like civil society organizations and human rights groups that come in to help bring the interests of the people to the table. So policy and politics, that's why, you see, that's why I'm telling you the nuances that you cannot teach. People have to go through the system and learn.
Hallelujah. I hope mmesikia watu wa MOH governors wenye health inawashinda. Alas, we have a very well-trained doctor here, ready to solve all your problems.
Very ready.
Okay, amazing, doc. So wish you all the best in your health and advocacy, and we hope to benefit from your studies.
I hope to assist the people as much as I can. I really want to help Daktari. I really want to help.
Good, that sounds
Eager. I am very eager, yeah. Yeah.
All right. On that very nice note, let's take a short break. When we come back, when we return, there used to be a Jeff Koinange meme on X-Ray. They used to say, when we return, we'll be talking about science. Stay tuned.